News alert. Hello, everyone, and welcome to The Five. I'm Kimberly Guilfoyle. We just heard moments ago from Speaker Paul Ryan and other House Republicans at a press conference on the American Health Care Act, the GOP's replacement plan for Obamacare. Ryan says Republicans will have enough votes to pass the plan in the House. Earlier, we heard from the president on the measure.
And I'm proud to support the replacement plan released by the House of Representatives and encouraged by members of both parties. I think really that we're going to have something that's going to be much more understood and much more popular than people can even imagine. I think it's going to go very quickly. I hope it's going to go very quickly.
His Health and Human Services Secretary Tom Price also made the case for this new bill.
That is that we need a system that's affordable for folks, a system that's accessible for individuals, that's of the highest quality, that incentivizes innovation, and that empowers patients. And so our goal is to absolutely to make certain that individuals have the opportunity to select their physician. In terms of premiums, we believe strongly that through this whole process and as it takes effect, that we'll see a decrease in not only the premiums that individuals will see, but a decrease in the cost of health care for folks. The American people have said to their elected leaders that the Obamacare process for them gaining coverage and care is not working. So we believe it's important to respond to the American people and provide a health care system that allows for them to purchase the kind of coverage and care that they desire.
Okay, so a big day for the House GOP Republicans, a promise that was made, a promise that was kept. Eric, what do you make of them? Well, this is Bob Beckel, or some bizarre individual that is occupying his body.
Go ahead, Eric.
Okay, sponsored by Insanity. Dana Perino, you're familiar with her. Eric Bowling, Greg Gutfeld. Okay, everyone good?
Thank you, KG, yeah.
You're welcome. Okay, Bowling, kindly proceed. So what do you make of this in terms of the merits, the structure, and also the rollout?
I don't see a lot of merits in it.
Okay.
This feels, someone said, is this Obamacare light? No, it's Obamacare 2.0. So all day I've heard Sean Spicer, I've heard Dr. Price, I've heard Paul Ryan tell us that there is no mandate anymore, but the plan actually does continue to have a mandate. The individual mandate is still there, only it's worse because now if you let your insurance lapse, you get a 30% pay. You have to pay 30% not to the government anymore. Now you pay it to the insurance company. Cadillac tax. They don't touch Cadillac tax. We fought against Cadillac taxes on this show for years. It's still there. It's not touched till 2025. Subsidies, they still go. There's more subsidies in this bill than Obamacare. Medicaid expansion. They don't touch Medicaid expansion for another 5 years. I mean, these are all the things we fought against. But the one that I really, really care about the most, the one that would make a free market solution, drive the cost curve down on health care and insurance, would be being able to buy it across state lines. It's not in this bill as of yet. I don't know why you put something out there that you say you're going to fix 2 more times over the next few months. Just fix the damn thing. You've had 6 years to come up with a replacement. Fix it. Put the across state lines in there. Put the tort reform in there and take out the mandates. You can do this, Republicans. There's no reason to do this, to vote on this bill now.
Brothers and sisters, hallelujah. Hallelujah.
It's a bad bill.
Hallelujah. Let's hear it for Eric Bowen. Come on.
Take it easy on the team.
Why are we applauding?
It's not paid
No,
for
it's
yet.
really good. I think I
He's kind of agreeing with him.
No, it is not a whole lot different. It puts more poor people out in the streets. Is what it does. But outside of that, I mean, Ryan, they say repeal or replace all they want. And they're trying to get that sunk into people's heads. It's not repeal. It's not replace. It is BS, and that's what it was meant to be, and it's not going to be law, so you don't have to worry about it.
God, you clapped so loud and you popped it out.
Well, I was very proud of Eric.
Okay, perfect. All right, Dana, so do you share Eric's concerns or sentiments?
Well,
Did they go far enough?
Not necessarily, because I feel like I've got a lot of reading to do, even though it is much smaller bill than the other one. But a lot of things that came out today are very interesting to me. Of course, we knew the Democrats were going to trash it, but conservatives are not going to defend it either. But here's the thing. President Trump says this is his bill. He says this is our plan. And for those concerned about the state lines issue, and I agree that that might be a concern, he said, well, there will be stage 2 or 3, so don't worry because that's coming. So I think that if this is going to pass, it is going to need the full weight of President Trump pushing for it. You saw what it took for President Obama. I think he gave 58 speeches about it. He lost his majority basically because of it, but he thought it was worth doing. And the race to define the benefits of this bill will be taking place over the next 36 hours. I do think that Secretary Tom Price arguably had the best presentation today and was able to answer questions in the most fulsome yet succinct way and with some confidence. They've got a lot of work to do. And here's the other thing. Today, Obamacare is at its most popular ever, at 4.5% above where it was before in the Real Clear Politics average. So if they want to get this done, they're going to need the president's help. And the president said he wants it done quickly, and he can make that happen if he chooses to.
Okay. All right. So, Greg, did you think this went far enough, or why perhaps did they throttle back a bit?
I think it was a good start. I have 4 positives. I think I have 4 positives here. Number 1, it's called the American Health Care Act, not the Kenyan Health Care Act.
Good point.
Thank you very much. So what does
I don't believe you just said that.
Delayed laugh track
I know.
over here.
What does a chasing dog do when it finally catches the car? This is what you're seeing. So a car finally gets it. It's the Obama car. The Republicans finally get it. And so they have to figure out how to do it. I don't think they were quite prepared. But the good news is this is a good worry to have. It means you won the election. Not being able to fight amongst yourselves about the repealing and replacement of Obamacare. Well, if you didn't have that fight, that means you lost. So this is actually a good problem to have. This conflict happens when you win elections. Third, I do like that it's smaller than the previous. You went from Mama June, from Here Comes Honey Boo Boo, to Dana Perino. You just took this giant thing and you made it smaller, and I think that empowers people. It's easier to read. Also, I talked to Dr. Mark Siegel, and the one positive thing that I didn't know before, how the tax credits work, which I think is positive. Who was really pissed off about this? The people that felt coerced by the mandate. The tax credits are now the lollipop. You take this money of the tax credits, you enter the marketplace, and you buy a more cost-effective plan, which is the catastrophic health insurance. So, I don't have to pay for your mammograms, and you don't have to pay for my prostate exam.
Hey, did you get your drug dealer late last night or what?
Why? I did my research, Bob.
I did mine too.
The tax credits, though, make sense, right, Eric?
But it's the same. It's a pig by another name. It's
right.
a pig with lipstick, because all you're saying is if you want that tax credit, you have to buy insurance. But if you don't buy insurance, you're going to get this 30% increase in your tax.
But isn't that at the discretion of the health insurance company, though?
No, listen to me. They're gaining the 30%. It's not even the government taking it anymore. It's not paying for Obamacare.
But conceivably, the health insurance company could decide from a competitive perspective not to.
Money that's been
if they want to win your business,
they want
to
increase their numbers.
If they really wanted to do all this, drop the state line issue and make it competitive.
But the president said that's coming.
I know, but they didn't say that at the beginning. All of a sudden, later in the day, it became phase 2 and phase 3 was going to happen. Here's at the end of the day, Greg, I know you hate this, but what does it really do to your insurance premiums? This bill, as we see it right now, does absolutely nothing to it. They don't go down at all. In fact, they may even go up. I've said this before.
So the dog chases the car and sadly gets hit by it.
I have a niece outside of Chicago who has 5 kids who can barely pay for her health insurance. She hates Obamacare. It's awful. This does nothing to her premium. Not a darn thing.
Bob, real quick, and I got to hit
Okay, what I was just going to say is that, on a very serious note, the Democrats would have gone along with the state lines thing. That's one thing that they would have agreed to.
Really?
And I'm amazed they didn't put it in. It's a no-brainer.
Well, maybe they will in order as a sweetener later.
Yeah, maybe it could be, but
what are they waiting for? It was one of the biggest talking points for the last 6 years.
This was the opportunity to put it through because they had the momentum and the goodwill. Well, as we mentioned, not all Republicans are happy with the legislation either, particularly Senator Rand Paul.
The House bill that's been put forward is Obamacare Light. It won't work. Premiums and prices will continue to spiral out of control. In fact, they acknowledge it in their own bill. But I think Obamacare Light doesn't fix it, and I think it's a real mistake to go for this. But the negotiation will be conservatives saying, hey, we're not going to take Obamacare Light.
Okay, so you're hearing some of this reaction today that they're Obamacare Light.
Well, I wanted to pick up on something Greg said because I think it's important. You said that at least they're having this debate.
Right.
So as Republicans, I can say, well, at least we're having this debate and not the other debate, because if Hillary Clinton would have won, then we would be debating whether or not to go to single payer right now, which is what the left really wanted. And so there will be Republican on Republican violence, and they'll have to try to work it out. But I do think that now that they have President Trump to be able to help them push it all together, he'll have to see how he can corral them. He might have to break a few kneecaps
It's
in a
also-
charming way.
Also,
In
you,
a charming
you have to
way, yeah, in a
understand,
nice
this is
way.
a historic first. I mean, you're having Republicans trying to create a government program. It's like a Democrat trying to say radical Islam.
Yeah.
No, it's
the
that
Republicans-
the Republicans have become the custodians
Yes.
of an entitlement program that
Right.
President Obama put in place, and they're trying to do it in a way that doesn't cost as much money. Instead of, if they're going to make people mad, why not just make them really mad, right, and do all of it at
The
once?
strange thing is, Dana, we've been talking about this for 6 years. They've had 6 years to fix this. CBO hasn't scored this. We don't know how much it's going to cost. We don't know how many people are going to lose their insurance, as Greg points out. If there's more or if there's
But I
fewer.
thought nobody believes CBO anymore.
But okay. But here's the
Hold on.
point. Putting
Bob, I see your hand,
putting
Bob.
that competition across state lines in the bill wouldn't affect the cost of this to any individual at all. It wouldn't insure fewer people. It wouldn't cost the government any more money. So the only thing I can think of is there must be a deal at the other end of that
Right.
somewhere. And
Maybe
what's the
so.
deal that we have to give up to get that?
Well, yeah.
First of all, I want everybody to know that Kimberly and I are still here. We're still in the show. I'll give you the political answer to the cross state lines. Eric's right. They use that over and over and over again. And for Democrats campaigning, it's a bad sales point. I mean, people say, what do you mean I can't buy it over there if I get it cheaper over there, right? So Democrats got tired of hearing it, and they ran the numbers. It didn't make that much difference.
Right, so they would say yes.
Yeah, they say, yes, that's free market. That's good. We're for it.
Well, that's
yeah,
good.
the problem is they're not going to be able to escape some of the criticism that we saw with Obamacare, because as it goes along, still may be people that are going to lose their coverage, which is going to be problematic, especially when you have a system that is not sustainable financially to support itself. It's eventually going to cave in on itself.
You know what this feels like? And I was talking to Dana about this earlier. It feels like, remember when Nancy Pelosi said we have to pass the bill to find out what's in it?
Yep.
They're almost asking us to do the same thing. Trust us, phase 2 and phase 3 will be great.
Right.
So vote for this now. I would like to see phase 2 and phase 3. Look, call me crazy. But first of all, I don't think they're going to get it. I think the Freedom Caucus in the House is going to say no. That's enough to
they've
kill a
got
bill. And there are at least 4 senators that would say no. That would kill a bill, too.
But then what does the president do?
I don't know.
Nothing.
I don't know.
All right.
Tweet.
What you don't do
good
is
idea.
don't ever call it Trump care. Just never call it Trump care.
I think you
right now.
just
Are you
did.
kidding?
Until it's good.
I'm glad
perfect.
you said that.
The new health care bill.
American
defunds-
health care bill, Kimberly. Get it right.
Hey,
Communist.
I'm just talent. I'm reading the prompter. Keep it clean here. The new health care bill is known as the American health care bill. Defunds Planned Parenthood.
Rollout of the Republican plan to repeal and replace Obamacare. The legislation will strip away all federal funding for Planned Parenthood for a year, something the president warned would happen during the campaign season. Listen.
A lot of people say it's an abortion clinic. I'm opposed to that, and I wouldn't do any funding as long as they're performing abortions, and they are performing abortions. So I would be opposed to funding. I would defund it because of the abortion factor, which they say is 3%. I don't know what percentage it is. They say it's 3%, but I would defund it because I'm pro-life. But millions of women are helped by Planned Parenthood. Planned Parenthood does some very good work, but I would defund as long as they're doing abortions.
But President Trump is offering the abortion provider a deal. The funding will stay if abortion goes away. Planned Parenthood has rejected that offer, saying they will always stand for women's ability to make decisions about their health and lives without interference from politicians. Okay, bring it around, KG. I think the offer, look, as it stands, federal funding can't be used for abortions, but, you know, that's that gray area of Planned Parenthood.
Right, certainly. So what he's doing is he's trying to make a compromise. He has acknowledged in the past that, in fact, Planned Parenthood does provide valuable medical services and screening for women. It does. The problem that they have is that it is, morally objectionable to millions of Americans that some of the federal funding from the United States government is allotted for abortion services. So the president is saying, you also take in a tremendous amount of money from private resources and donations. Perhaps you should earmark those funds that are private. Do with it what you will. That's their business for their organization. But federal funds should not be marked for that.
Well, let me get Dana in.
Of course.
Get the women in first.
No problem.
Don't you think they've
Listen, the 4 has been one of the best shows I've seen in a
formed
long time.
opinion on this? Your thoughts on both the Trump administration and the Planned Parenthood response?
So I think this was a chance for President Trump to fulfill a campaign promise, and social conservatives really want this. Republicans want. I remember when they were going to shut down the government last year, when Republicans were all mad, and they said that the one thing that they really were mad about was that the Republicans weren't able to pull funding for Planned Parenthood, even though Planned Parenthood itself actually has a pretty good approval rating, so it was harder back home. So there are some senators, like Susan Collins of Maine, I think, who said that this shouldn't be in the Obamacare bill at all, or I guess what we're calling the American Health Care Act. The money instead they're saying will go to community health care centers. I don't know if there's going to be enough acceptance of that. Cecile Richards of Planned Parenthood, they're going to fight tooth and nail. And I think what will actually end up happening is Republicans will put on the table that they believe that access to contraception should be available easily over the counter, and that would be a way to maybe try to get this funding pulled, but be able to provide access to the kind of products that they provide there.
So get it straight, Greg. I think are you saying provide funds, but earmark it for contraception?
Well, the money would go to community health centers, and arguably the community health center would say, "Oh, well, we can handle this better than Planned Parenthood."
Where are you going, Bob?
Oh, nowhere.
Well, I mean, it comes down to it. If you believe that abortion is the taking of a life, then forcing you to pay for somebody else's abortion is a moral intrusion.
Right.
That's the argument. I'm amazed how the media salutes conscientious objectors over war, but not abortion.
Yeah.
And so instead, what the goal here is to dehumanize the unborn child to massive cells. So it's like a medical procedure, like getting a mole removed. So therefore, somebody else could pay for it. So someone actually has to speak up for those who cannot speak for themselves, which is why this dialogue, wherever it goes, is important, because you're actually talking about this question.
Bob, why can't Planned Parenthood just decide to have one service for abortion and separate it with a Chinese wall and all the other services?
Well, they do. But no, I hate to correct my learned colleagues here who actually have degrees. But there are not a single dime of federal dollars going to abortion. Something called the Hyde Amendment. Henry Hyde made this.
We're all familiar with the Hyde Amendment.
Well,
but if 80% of what Planned Parenthood does is abortion,
no, it's not even close to
and
that.
we're giving them $300 million a year.
It's not. Look, you're not asking a taxpayer to pay a single thing for an abortion. Planned Parenthood does, among other things, a lot of screaming, a lot of mammograms, saves a lot of lives. And the idea that he'd pick on this, first of all, he was pro-choice when he was thinking about running for mayor about 15 years ago. And the other thing, he has no idea. He doesn't know what Planned Parenthood does. Anyone?
I actually think he does.
Trump care?
Well, one, I do believe that anybody can go from being a pro-choice person to being a pro-life person.
You did, didn't you?
Yes, I'm pro-life.
Right,
Yeah,
so
but I didn't.
that is possible. That is
People can
possible for
change.
President Trump.
But I didn't do it for political reasons.
Well, how do you know that he did?
Well, I just sort of made a guess. It's on the campaign trail.
I think that you don't know any. None of us can say what's in somebody's heart when it comes to that.
Or his head, which is the really hard.
Remember, he had a very personal, moving story about this.
What?
President Trump had a very personal, moving story that he said that really changed his heart and his mind about abortion.
We got to go, but Bob Beckley, you're pro-life.
Yes.
And you're okay with sending $300 million to Planned Parenthood a year?
I'd send $1 billion. I'd send $1.5 billion. I'd do $1.5 billion if it were up to me. And I do it on because of faith. Because my faith doesn't allow me to accept abortion. I knew that changed about 8 years ago.
Oh, so
I'm
now you
not
want to
questioning that part of it. I'm just questioning the funding part of it. I got to leave it right there next. New words from the White House on President Trump's allegations that President Obama had him wiretapped during the election. Stay tuned.
Today in the White House briefing room, and he had a lot of questions to field on President Trump's weekend wiretapping claims.
In those 3 days, has the White House come up with any evidence whatsoever to prove that allegation?
Yeah, I addressed this multiple times yesterday. I think the president, we put out a statement on Sunday saying that we would have no further comment, and we were asking the House and the Senate Intelligence Committees to look into this concern.
Can't the president just ask the FBI director?
Well, I think.
Has he asked him?
No, the president has not.
Will the president withdraw the accusation? Does he have any?
Why would he withdraw it until it's? Until it's adjudicated.
Does the president support Director Comey? And then a quick follow-up.
I have no reason to believe he doesn't.
Homeland Security Secretary John Kelly thinks the president's concerns shouldn't be dismissed.
If the president of the United States said that, he's got his reasons to say it. He's got some convincing evidence that took place.
If Comey went public and said this never happened, as Clapper did, the former director of national intelligence, would you believe Comey?
I would expect Jim Comey to then turn that over to some investigative arm, and we could get to the truth, or to the bottom line. Again, Jim Comey is an honorable guy. So is the President of the United States, and the President must have his reasons.
Director Comey appeared before cameras today at a ribbon-cutting ceremony, but didn't address the subject. but he will be called to testify on March 20th at an open public hearing held by the House Intelligence Committee on Russia's alleged meddling in our election. So around and around we go on this. The question that they have a hard time answering, Kimberly, is why doesn't the president just ask for the evidence to come over to him if he's that concerned about it?
Yeah, and the thing is, we just don't know. We don't know what stage of the proceeding it's in. We don't know who he's contacted, specifically whether he's asked them to proffer any kind of evidence, the purpose, the nature, the subject matter of any warrant that was contemporaneous with that time. Was there a warrant that was larger and encompassed actually the area of Trump Tower, et cetera? They were able to do the metadata stuff and actually retrieve that from, we don't know. And so I guess in due course, when the president decides, he'll let us know. But certainly it was a bombshell of a tweet and of a news story and breaking news. And now everybody is kind of scrambling to find out. But unless you actually see the facts and the proof, you know, we really can't know.
But they're going to get closer because Devin Nunes, who is the congressman from California, he's the chairman of this House Intel Committee. Eric, he's asked for all the documents from the intelligence community by next Friday, the 17th, and then a public hearing on the 20th. And I think he said today that James Comey, that he doesn't necessarily have faith in him. So if they don't have the faith in the witness that they're calling, is it prejudging the outcome of the investigation?
Well, those hearings, you know, no one's really held by those hearings. I mean, you can go.
It will be open, which will be different for them.
Right. So you can say whatever you want, and then you can, you rephrase things later. Here's my issue now. Okay, again. January 20th, that New York Times reporter, Michael Schmidt, who is the one who broke the Hillary Clinton email scandal, private server scandal that was so massive, New York Times clearly writes wiretaps at the Trump Tower, and the report was given back to President Obama. So they're, according to him, and I'm guessing he sourced it and second sourced it, these taps were going on. How did he know about it? He had to have a leak. It had to come from intelligence somewhere. Okay, fine. On March 5th, on Sunday, Chuck Todd asked James Clapper, was there any surveillance at all to Trump Tower? Not to Donald Trump, but to Trump Tower. And he said, none whatsoever. Today, Bill Hemmer asked General Hayden if there was any surveillance on Trump Tower. General Hayden said, if it were up to him, absolutely none whatsoever. So you have Comey, Clapper, and Hayden saying there was none, yet a very respected reporter saying he has, sources saying that.
So Hayden hasn't been a government official for many years.
But according to him, he said there was none. And
he's got good sources, but he wouldn't have been responsible.
Director of the NSA for a while, right?
Yes, but not for years.
Right. Okay.
All right, Bob, you're sitting there like a cat.
Well,
Cheshire cat.
I just,
sweet.
because I love you all so much. I used to say to my candidates when they're digging themselves in a hole, hand me the shovel.
Oh, did you?
You guys have got to stop this. It is ridiculous. The reason Trump doesn't have evidence is he's lying. It's not true. You could pick up the phone and find out tomorrow if you knew anything about the intelligence community. The idea of bringing the Hillary Clinton emails in with what Trump said Barack Obama tapped him. Now, if that's the case, he's accused him of federal crime. He'll put his evidence up. But why not? Because he's lying. He doesn't know.
But in the meantime,
and take care of Trump care, right? And leave wiretapping so people know what they're doing.
Okay. In the meantime, we saw there's
Trump's
activity in South Korea because they're worried about Korea. This was your point yesterday. They're worried about the North Koreans, and maybe we should.
Yeah, I think we should put a moratorium on this story for at least a week. We're going to pull a muscle defending or condemning Trump. I'm going to go back. People disagree with me. I think it was a tweet born of frustration over Sessions. It shouldn't have happened, but it did. But we're running around this story like crazy people, and we're assessing a tweet with this hyper-literalism. It's a tweet that he did in the morning, and the winner, again, is always going to be Putin. Chaos is his yoga. He enjoys every minute of this, and we contribute to his victory by constantly playing into hysteria. Let it rest for a week until we have some facts. I'm getting tired.
What muscle are we going to pull? Heart muscle.
I think Bob's already pulled the muscle.
No. I have to agree with you. I think it was born out of frustration. But the thing to have done would have been to send one more out and said, I was frustrated, I was angry, I was mad, and I really don't have the evidence.
Or there's an alternate. There's another idea that maybe he was told by someone, an intel official, who said, yeah, we did have a FISA warrant and we were listening. Maybe it was after.
But Bowling, do you notice what those three stories you said were Trump Tower specific?
Right. Yeah, but that's what I said. My point is,
sure there wasn't one that said Trump Tower.
When you have Comey and Clapper saying, no, there was none, then you have a problem when intel's denying it. Not the Obama part of it, but the Trump Tower part of it. Then now I'm scratching my head. Now, why is James Clapper saying there was none? I mean, We know there was.
Just so you know, both Trump and Obama got briefed on all this stuff during the campaign, number one. So Trump knew everything that Obama knew. And this other thing is the idea that you would sit there and suggest, I know you don't like Barack Obama.
What?
And you know I don't like Trump, sir, but that's not the point. You're accusing the President of the United States of a crime 20 years in jail.
Of anything, Bob. What the hell are you talking about? I said you have the head of the FBI, the head of the DNI at the time, saying that there was no tap to Trump Tower whatsoever, and we know there was.
Okay, it was a bad tweet.
All right. Well, round and round the mulberry bush we go. Ahead, can America survive a day without a woman at work or at home? Women across the country are going to try to prove it's not possible. That's tomorrow. But will they?
Is a day without women, a left-wing event designed allegedly to raise awareness of women's contributions. So women are being told to celebrate the day by skipping work. There's a great message for kids. So you're mad Trump won? Go home and sulk. I say kids because roughly 80% of primary teachers are women. So naturally tomorrow, who's missing? Teachers. In some cities, public schools have had so many women call in sick, they're shutting down. The event is based on the idea that women are oppressed. Maybe so, but in the U.S., try the countries that sanction actual abuse. But somehow I doubt these organizers will. So, do women need to take time off to deal with an election? What if men did the same thing? Electricians, sheet metal workers, bricklayers, tilers, jointers, truck drivers, laborers. Why not call in sick because it's Men's Day? How would your wife look at you? She'd laugh your lazy ass out of the house. So how come it's okay for a woman and not for a man? Is it our inherent sexism that creates lower expectations for women? And what are we saying about teachers? That they're not as vital to civilization, so go ahead and play hooky, no one will care? But men's jobs, those matter, so you stay right there. So ironically, the women behind this posturing assume women's careers are less important. Well, I hope the teachers spend the day off with their actual kids, unless that's just another job, too. Wow, you know, I don't know where to start here. It's so ridiculous.
This is a bad idea.
Yeah, it is a bad idea, Kimberly. It's like it's all teachers, and so the kids suffer.
Well, that's exactly right. I think it's very selfish. I mean, if you really are passionate about what you do, you march forward and you go into those classrooms and you say, women are making a difference every single day in the lives of millions of Americans, and starting here with the classroom and children. Why would you want to have a child that's desperately in need of an education suffer at the detriment because you're upset about who's in the White House? I mean, this is just ridiculous. Go to a march if you want to. There's plenty of them, you know, and you might make an extra $50.
You know, Dana, if this job, if this were a job that your boss would say, okay, you're not getting paid, this is like a teacher's job. I'm assuming that they're getting comped.
Oh, you mean like they're taking a sick day?
Yeah.
So yeah,
but I don't think it's a sick day.
I do want to make it clear I will not be here tomorrow, but it's not because
Neither will I.
I'm taking the day off. I am actually going.
Oh, where are you guys going?
Well, I'm going to Africa, and I'm going to be a part of the Mercy Ships because tomorrow is actually International Women's Day. And one of the things I learned, but it's been reinforced for me, is that women who live in freedom, like we do, have an obligation to help women around the world who do not, and that need access to all sorts of things: healthcare, food, education for their children,
so
energy,
that's a good use.
Business. So I don't know if taking a day off tomorrow is worth it for these other women. Like, what? Maybe they're all going to go and do some service projects or something like that. But it does seem to me that. What about the single mom that has to figure out how to get child care for her child tomorrow?
Yeah, babysitter, and the babysitter has to be a guy.
Right.
Because there's going to be no girl babysitters, so that's going to cut down.
Apparently, Bob's available in case anybody's looking for someone to take care of their kid tomorrow.
Also, Eric, what about the teachers? Will there be peer pressure not to, like, they're at school, right? And all of their peers are going, but they're staying. Will they be looked down upon?
Yes. Like the union line?
Yeah. You're a scab.
Look, fine, you want to do this, take a day off. Here's the only issue I have is at the public school part of it. In other words, so everyone's going to pay their tuition. You pay your taxes. Yeah, somebody goes to tuition. And so people who don't have the same grievance are paying the teachers to take a day off.
That's true.
Public schools.
Yeah.
And I believe there's a handful of schools in Chapel Hill, North Carolina doing it. It's not fair to the rest of the people.
What about the moms at home? You know, who's going to, they're not going to take care of their children. I don't get this. I think there's other ways to voice your opinion, and women have fought so hard for so many rights in this country. I think the best way to show them who's boss is to celebrate by showing up for work.
Working.
Bob, do you how do you think the brass here would take if you called in and said, "I'm going to take tomorrow off because it's a special moment for me"?
They do the wave.
First of all, there are a number of things you have to be careful about here. One is that there are especially important people like nurses who should not take the day off, obviously.
That's my point. You just said that's an important
You know
job.
why? Because Bob may need one.
Wait a second.
Teaching isn't?
Go
ahead.
Women in this country do not make the equivalent of men. And until they do, they ought to stay home all the time if they want to, if that'll get it from them.
What? You don't even have a fact behind that.
Yes.
Yeah, tell me when you get is it the 70
somebody
cents on
called
the
the
dollar?
brain room, for lack
Is it
of a better
70
word?
We've already debunked that many times.
What, 79 cents?
Yes, it's over.
You're saying they get $1 for $1?
No, close. Close.
Anyway,
Close.
and the only other important people are cops, and I would just hope that there'll be a lot of sore shoulders tomorrow.
Do you think the women working in Planned Parenthood are going to take the day off tomorrow?
What is
Fewer
that?
abortions.
Yes.
There's a silver lining there.
And by the way, I think George Soros has given over, what, $250 million to groups that are partnering with this march.
What's wrong with that?
Hey, you're okay with it?
Notice Bob only
It must
wants
be
the
wrong.
nurses that he might need to show up for work.
No, I need the physical therapist.
All right, Bob, don't dig a hole, as you always say.
Yeah.